Concern over the coronavirus has led to a relatively new way of getting medical help. Many people are now turning to telemedicine.
So far, the most widely used form of telemedicine was to bring remote care to rural areas, typically by phone or video conferencing. But now, with coronavirus, it's expected to be put to the test everywhere.
Telehealth offers the ability for people to call in and have a virtual visit with a California licensed physician.
Dr. Richard Seidman, Chief Medical Officer for LA Care Health Plan.
Most often, doctors are able to take a thorough history and understand by asking you a series of questions. They can make a diagnosis, recommend treatment, and they can prescribe medications.
Dr. Seidman says telemedicine allows doctors to safely treat patients and at the same time help contain the spread of viruses at hospitals, clinics, and medical offices. Chris Seidman, KNX1070 News Radio.
There's a new technology being put to the test because of the coronavirus, and you've probably heard of it. It's called telemedicine.
Both patients and doctors are turning to telemedicine these days.
This is the time for telemedicine really to shine.
Dr. Richard Seidman is Chief Medical Officer for LA Care Health Plan. He says telemedicine is basically a virtual visit to a health professional.
Telemedicine offers yet another chance for you to get needed health information, including diagnoses and medications as needed, without having to leave your home and without overwhelming the emergency room and the healthcare delivery system at large.
Until now, the most widely used form of telemedicine was to bring remote care to rural areas, typically by phone or video conferencing. But now, with coronavirus, it's being put to the test everywhere. Chris Seidman, KNX1070 News Radio.